get started. Welcome to September office hours. I will be kicking it off today and hosting. There is a small emergency at the office, and Travis had to evacuate.
Said something to me. I said, "Well, I haven't eaten." He
Somebody
goes,
is not on
"Oh,
mute,
well, I jumped off
and
taking
I do not have the ability to
today."
mute everybody.
So then,
Okay, perfect. Thank you. So I have to admit people because Travis cannot be on. Hopefully he will be joining us as soon as that little emergency ends at the office. So like I said, it's September office hours.
Trace is
So
here. She brought me up a bagel and
sorry, I
no,
was
I
just
haven't had anything.
Boring. You're not muted.
Said that, but it's here for when
there
I'm
is
ready to
no
eat it.
mute all button because I'm technically not the host. Okay, perfect. All right, we'll go ahead and get started. So today's agenda, it should be a pretty brief office hours. We're going to review some policy and procedure that we have put out, some updates to that are going to be forthcoming, some children's updates. I will try to speak to them the best that I can. There are still a lot of unknowns with those updates. And I do have Hannah, who is going to be taking questions for me. So if I cannot answer anything regarding those updates, we're going to take the question and someone will get back to you. We got some quality management, performance, and compliance updates. And then we are also just in the middle of redesignation. So we just wanted to give you a little brief update on that. So for starters today,
Yes.
we have, yeah.
It's Taylor. I don't know if anybody else is having this issue, but the slide deck isn't moving. We're still on the home page on my screen anyway.
That's weird. It's moving on mine.
Same here. It's not
It's
moving.
not moving.
Awesome.
Okay. That is
It's going well.
going perfect. It's moving on my end.
It may not show us because you're not the presenter.
I tested it with Travis right before he had to vacate the office and it was working. Hang on one second. Let me stop sharing and let me retry that. Let me see if that works. Share window. Can you see it now?
I can see the homepage, Health Home September office hours.
Just the homepage. So you, when I move it.
Yep. I can see it moving.
Okay. Perfect. And I will not put it, the only thing I did is I put it in slideshow mode, so I'm not going to do that. So we will leave it here.
Okay.
Rockin'. All right. Great start. So policies that we've recently put out, those have been access to services, our eligibility and appropriateness criteria policy, health home supervisor and caseload ratios, quality assurance, performance improvement, and compliance. And then a couple of upcoming policies that we're going to have coming out is going to be our CANS policy. There's going to be some changes with the CANS certification, kind of waiting on those details to get that policy out. Our plan of care adults policy is being updated. Core service and billing for children, we're going to touch on that a little bit today. That did go out, a draft version of that. So you guys do have a draft version. We did get a secondary version to that from the state. I will not be updating the draft version of that again. Once that goes out, it will be the final version, but we'll touch on that a little bit later. HCBS disenrollment, that's going to be for those HCBS kiddos, and our system access policy. All right, so access to services. This was an annual update. There's no changes to this policy. Again, this policy just goes, speaks to the fact that any member that we enroll, they do have to have access to a care manager 24/7. And each CMA is going to design that a little bit differently, and that's left up to each CMA how they're going to handle those on call, as you will, circumstances that may come up. Does anybody have any questions on this policy? All right. The next one that we have updated is our eligibility and appropriateness criteria policy. This is everybody's favorite because it has the addition of the CES tool information in it. For this policy, we added a definition on what counts as an interdisciplinary team meeting. There's going to be a lot of changes for that as it relates to children. So we wanted to make sure that we added a definition into this policy because it is part of eligibility. One of the other things is that the eligibility screening has been moved from 30 days from the date of consent date to 28 days. So we wanted to make sure that we changed our policy. Then we wanted to just make sure that we had some clarifying language in this policy that ensuring that a member is eligible and appropriateness for the health home. That verification does come from the health home care manager, the CMA supervisor, whomever is doing the referral process at each CMA, and that's a little bit different. So that is the person that should be verifying that that member is eligible for health home and appropriate for health home. And the other thing we always want to make sure that we're doing is we're checking RE codes, because just because there's an RE code there and it says it's compatible, it doesn't mean that you don't have to do anything. Sometimes, especially if we have those 95 codes, you really want to make sure that they're not engaged in receipt of any OPWDD service or any other RE code that could potentially be incompatible should they be engaging in service. We also wanted to add a little bit of clarifying language about our HIV population. So this goes for anybody who was working with a member who has a diagnosis of HIV. We really want to make sure that we know the viral load for that member, and that viral load is recorded in that HML. It does drive billing, so it is important for you guys to be aware of that, but it also should be uploaded into the member's record also, so that's supporting documentation. So you can get that through various resources, but if you're working with a member who is diagnosed with HIV, it is very important that you obviously stay in touch with their providers, but you also have an awareness of what their viral load is, and we're recording that in the HML, and we're uploading documentation to support that. The other thing that we wanted to touch on is we do get some validation codes that are provided by MAP. Courtney has been sending those out to everybody. So those codes are going to tell us when something is kind of coming due. So it's a little bit kind of like Data Den. We get those codes that saying X is expiring in such and such days, or X is overdue. Courtney, as part of her workflow, will be sending those alerts out to everybody. So even though you use DataDen or you may have your own tracking system internally, Courtney is still just going to send those out to everybody. It's too hard for her to track who needs those, who doesn't. They're going out to everybody. But if you have something that's been taken care of, you can just let Courtney know it's going to be taken care of, or you're following up on it. The other thing that I wanted to point out is this policy was published stating that the dates pertaining to the CES tool had moved from 60 days to 56 days. So if you had a discharge or you needed more information, you had 60 days to do it, and the state had put out documentation that said 56 days. That, in fact, is inaccurate. They had come to us, of course, after this policy was published to all of you, and let us know that that's actually an error. That date is staying at 60 days. So the current policy that the state has states 56, or states 56, but it is 60. We will be updating that and reissuing a policy with the correct timeline. Does anybody have any questions on that? All right, perfect. The next policy that we updated was our supervisor and caseload ratio policy. There was no really policy changes to this. It was an annual review. The only thing that was updated was the language around the CANS 2.0. So that was language that came with the complexities versus acuity, where we have complex instead of high. So we just updated the language, but the actual policy did not change in any way. Does anybody have any questions on that? All right. The next policy that was updated was our quality assurance, performance improvement, and compliance policy. In this policy, we added definitions around what a corrective action plan is and what a performance improvement plan is. Because as you know, some of you are being placed on a corrective action plan versus a performance improvement plan. So we just wanted to add a definition around what differentiates the two of those and what each of those kind of mean. It was a recommendation from one of our CMAs. We also added language. I know this is probably a given, but we wanted to make sure that it wasn't writing it in our policy, that even though we have certain timelines where we do audit our CMAs for various reasons, we did just want to put in there a note that we added language that the health home at any given time can audit any CMA. We could do a spot audit, a full audit. It's always at our discretion. So yes, we do have things that are on a certain timeline that we do audit for, but we also added that in there because we just wanted to be able to, something will come up and we want to look into something, and a need may change for auditing. So we just wanted to add some language in there. And we did add some specific Health Home Plus billing and documentation audits. You guys saw that on your last round of quality notebooks. So we do have those going forward. Those right now, we're not sure about the frequency of those. It's really at Health Home discretion right now. It may become more regulated like twice a year, but right now it's something that we're just going to continue to monitor. The other thing is that we updated the language around the CES tool being due to the date in the quality policy just to match the eligibility policy. We also overhauled the entire section in the quality policy that relates to children's HCBS. That was updated due to our corrective action response due to our last HCBS audit. So that entire section has been kind of cleaned up, and we have a new auditing plan for those kiddos. And there is a required oversight and review of that section of the policy. So if you are a children serving CMA who has any HCBS members or who has ever served an HCBS member, it is required that a supervisor attend one of those 2 dates. So on September 25th at 1 and September 30th at 9 a.m., I gave 2 options. A supervisor must attend to review that HCBS quality section. If you cannot make it, just let me know and we can set up a one-off meeting. Does anybody have any questions on that? All right. So next for children's updates, I just wanted to keep touching base on the comprehensive assessment. We are working on, again, kind of combining that into one assessment with the CANS. It's still kind of 2 separate things, but it's all going to be done at the same time in the same system. So we'll all be done in the UAS. We are still moving forward with that. We're still in the final stages, and we are still looking at an early 2025 implementation of that. So with that, there's going to be policy changes to our comprehensive assessment policy and our CANS policy. As you know, for the longest time, we had the CANS being due within 60 days. Then we moved to a 30 days. It is now moving back to that 60 days. So you will see policy update to reflect that. So for right now, still get those CANS done within the 30 days. And moving forward, when this new policy comes out, that's when we will switch back to that 60 days. And we do have a couple of upcoming webinars that pertain to children. So not only do we have those HCBS quality review for supervisors only. But on the 26th at 9:30, we have a children's plan of care overview. Then on the 1st at 10 a.m., we're just going to do a brief overview of CFTSS services. We just put a quick slide deck together just to kind of review those services, who you would refer for, what kind of does that service look like. It's just going to be a brief overview. It should only be about 30 minutes. And then DOH just put out a webinar also for the 1st at 1 p.m. They will be hosting a webinar. They say it's an IRAMS webinar. However, I just want to let everybody know that yes, it says it's an IRAMS webinar, but it is really about the workflow as it pertains to making referrals for HCBS and really what is the care manager's responsibility about those referrals. So not just physically putting them in the system. What does the oversight of service provision look like? So it is more robust than just entering into IRAM. So I do encourage everybody who serves HCBS youth or has the potential to serve HCBS youth to please attend that webinar. Does anybody have any questions on this slide? All right. All right, we're going to move into the new core service and billing policy for children. This is going to be a pretty big policy change for how we bill for children's activities. I did send out that draft policy. We then did get another version of that policy, like I stated earlier. I'm in the process of combing through that. They did not give me a guide to edit, so I'm not sure what was changed on the first policy versus the second policy. I kind of have to read through and compare them to. And so far, I really can't find any big changes between the two. They are still slated for a go live of December 1st, 2024 to get that new policy rolling out. And NetSmart is working on a new CBQ to kind of reflect all of these billing changes. And there is one children's health home that is piloting that new CBQ. So they're kind of working through making sure that it fits the needs. So I just wanted to do a quick little overview as what the changes to that policy will look like as it pertains to billing. So for the low or standard group, so our formerly are just low kiddos, you're going to have 2 core services per month with a quarterly in-person visit with an annual interdisciplinary team meeting. Then if you move to early development intensive, so that's the former medium, that's going to be 2 core services per month. One of those need to be in person, and now you're looking at having an interdisciplinary team meeting every 6 months. If you are of complex acuity, so formerly our high group, you're going to be looking at 3 core services per month, 2 of which are in-person contacts, and then a quarterly interdisciplinary team meeting. If you are serving the high fidelity RAP population, that's 4 core services, 2 of which are in person, and you have that monthly, they call them child family treatment team meeting. There are some allowances that we've never had before. So if you do not meet the criteria, let's say you have a youth that is complex and you don't meet your 3 core services, 2 of which were in person, you don't meet that, but you meet, let's say, the intensive level, you will be able to bill at that lower level. So prior to this policy, if you did not meet your core services, you weren't able to bill at all. Now we will have some allowances to bill at that lower level, all of which will be driven by your responses in the CBQ. And there will also be some allowances for telehealth options, and that's just going to be acuity based. But some of these services are going to be allowed to be delivered via telehealth. I'm sure there's a lot of questions on that, and I will answer them to the best of my ability. If I cannot answer them, please ask your questions. Hannah is going to track all of those so we can get answers for you. So does anybody have any questions on those CBQ changes? Okay, if you don't want to ask them here, that's fine. I also did send out that draft policy and I let everybody know that you can feel free to just mark it up and send it back to me if you do have any changes. There is a DOH FAQ document out. I do find it to be a bit evasive when they answer some of those questions, so it's not really giving an answer. But I'm sure as this rolls out, we will have lots and lots of questions. But please, I do encourage everyone to please look at that draft policy that I did send out. It is complicated. I love policy. I do find this policy to be complicated for billing for children. So I do just want everyone to kind of take a look at that. And if you have any questions, you can reach out to me directly, or you can refer your questions to the health home. We do have some other changes for the children's population in the UAS for trainings. So on 9/17, the UAS sent out a notice to all users regarding some system updates are going to be happening on 10/1. There are going to be newly required trainings. They're going to initially show up as recommended, and then they will move to required. Right now, the state's projecting that they'll show up recommended on 10/1 and move to required on 1/1. However, that is not a date that is set in stone. So as I get updates from that, I will let you guys know. And then what you're going to see in the 10/1 release is you're now going to see, as you go in to complete the cans on some of your members, you're going to see a high fidelity wrap node is what they're calling it. This will allow everybody that is enrolled in children's health homes 6 to 21 to be screened for children or for high fidelity wrap if you're 6 to 21. And it's just going to be 2 questions. The first question is this member engaged in high fidelity wrap? And then the second question to that is, does that member have an FCD diagnosis? And if depending on how you answer that right now, really is kind of means nothing, but moving forward, there will be workflow associated with this for everybody who is enrolled in health home. So even if your CMA does not serve the high fidelity wrap program, every single care manager that serves a child in children's health home will have to screen for high fidelity wrap, be able to speak to what high fidelity wrap is, and offer those services to that family. I have not seen this yet in the system. I won't know until 10/1, just like everyone else, what kind of all of this looks like in the system. We weren't given a preview. I am told at this point it's just those 2 questions, because eligibility for high fidelity wrap is also meeting this. Then you also have to meet certain levels of, we'll call it service level is the best way I can describe it. It's similar to HCBF, so you have to meet certain risk factors and criteria. Then they also did update the list of reasons in the UAS where you can update a CANS due to a change in circumstances. So those have also been adjusted, and those were also put in that 9/17 notice that went out. Come 10/1, there were going to be some changes on how CAN certifications will be completed. So right now, everybody knows you kind of do that quote unquote live training. So we have that, and then you go in and you do your test, and then you do your 1 vignette assessment. They are going to be moving away from that. Come 10/1, the way that people will be certified and annually certified is you're going to have to go through this self-progression training is what they're calling it. That should take you about 3 to 4 hours. Then you're going to have to attend a half-day live virtual booster training. I believe that's similar to the one that we do now initially. And then the certification test, instead of it being one vignette, it is now going to be 2 vignettes per population. So it's going to be for 0 to 5 and for 6 to 21. They're also adding onto this an HCBS certification, which will be 6 online modules. So you will do that right in the UAS, and it has not been determined if this is a one-time certification or if it is something that you're going to have to do repeatedly. And they're looking again, like I said, a 2-1 or a 10-1, it'll be recommended, and then 1-1, it will move to required. And Lori, I did not hear you, but I did see that you sent in that you have a question.
Yeah,
Oh, there you
not
are.
sure. You can hear me now? Okay.
Yes.
Can I back up to the high fidelity wrap, and my apologies if I missed something along the way, because I tend to just leave all this for Angela as her problem. What's going to happen though if you assess?
Oh, she cut out for me.
Yeah, me too.
Okay. Lori, you cut out. We can't hear you. All right, Lori, you can also just type your question in, or you can send it to us after. I didn't hear enough of it to kind of guess what you were trying to ask. But does anybody else have any questions pertaining to any of the children's updates?
Jessica, it's Raquel.
Hi.
So Trish and I have to get recertified for our cans this month in September. So it's
Okay.
so this month it'll just be the same way we've been doing it. And then,
Correct.
Okay.
That is correct. However, even if you recertify now under the current version of, we'll call it CAN certification, what has not been answered for us is, will everybody have to be retrained under this new way, or will it happen as your certifications are due?
So if we don't have any cans that are due in September, would it be smart to just wait till October 1?
I would, even though October 1 is going to be a more difficult certification, I would wait because we have the unanswered questions of if it'll have to be done, so you might have to do it twice.
All right.
So
if you
that's
get an answer to
completely.
that question in the near future, can you let me know?
Yes, I have a meeting on Thursday at 1 o'clock, and I am hoping to get some answers at that meeting.
Okay, that would be great. Thank you.
I'm hoping, but no promises there.
Gotcha.
And Lori's question is, what will happen if a child is identified as high fidelity wrap who is certified to provide high fidelity wrap services? That is a great question, Lori. So right now, as high fidelity wrap rolled into Children's Health Home, it actually rolled in on 1/1 of 2024. Since it has done that, it has only been continued to operate with providers that have already been offering that service. So for right now, if someone comes back that is flagged potential for high fidelity wrap services, and I did look at a flag in Psyches for this, and we do have about 17 kiddos between Warren and Washington County. I'm just pointing out those 2 counties because that's where Lori and Raquel serve. We have about 17 kids in those 2 counties. Right now, nothing, because it's not really being offered at all in those counties. However, in early 2025, they will be opening that up to expand high fidelity wrap services. So once that happens, we're going to have to identify where are our kiddos that could be eligible and where do we need some high fidelity wrap care managers. However, it will still be left up to each CMA if they would like to have high fidelity wrap in their program. So Lori, if you would like to pass on having a high fidelity wrap care manager, that's fine. But as your care managers assess these youth that may come back high fidelity wrap eligible, all of your care managers are going to have to speak about what high fidelity wrap is, offer it to the family. If the family declines, you're going to document that in the member's record. If the family says, yes, I would like to participate in that program, you would then transfer that youth to that CMA that has a high fidelity wrap care manager, and then the case would transfer over there. And then you're in high fidelity wrap for roughly a year, and then you would step back down into health home. And at that point, that youth would then either transfer back to AMH or they could stay at that CMA. That would all depend on member preference at the time. However, high fidelity wrap care managers cannot carry a mixed caseload. It has to be an entire caseload of high fidelity wrap children. So they're going to have to move. So at that point, it would just be preference of CMA where they stayed. So if they came from AMH, they can certainly go back to their previous care manager there. I hope that answered the question. Is there anyone who wants to do this? It's very complicated. It is overseen by OMH. I don't know if anyone's going to want to do this. I can only speak from myself at the lead level, and we do have a responsibility to ensure network capacity. So I do have a responsibility to ensure that if I have 17 kids in these two counties that are identified as high fidelity wrap, I do have to ensure that I have capacity for them to be served there. All of you are allowed to basically say, no, we don't want to do this. Unfortunately, I will be probably throwing my internal care management team under the bus because we do have to show that we have capacity. So if everyone kind of doesn't want to participate in this program, that means that internally we will have to develop it in order to meet that need. So that kind of answers that question.
Jessica, it's Raquel again.
Yep.
So is this a service that, like, if a child is identified as the high fidelity wraparound service, is that like they have, like we are required to send them that way? Does the family have any choice in it? Like, I don't know. I mean,
Yep.
You know
So
what I'm
it's
saying?
it's 100% a family driven decision whether they participate or not.
Okay.
You're
So
only
if we do it
responsible.
and they come up as somebody who is eligible for that service and you discuss it with them and they say, no, I'm good with you, and you document it, we're good.
Correct. Yep.
Okay.
That is how that is going to work. Yep. So they have the choice, just like to participate in HCBS. It's member choice. They don't have to participate in it. They can if they would like, and that would be the same thing with high fidelity wrap. Lori said the training was cumbersome. Did they change the documentation process? And can we ask that they do? That's a great question. They have not changed the training. It is cumbersome. That is still there. The documentation is all still there. We have asked, with the incorporation into Health Home, what you will see is the documentation streamlined and built in NetSmart. So you won't have to document outside of the system anymore. You'll be able to document your work directly into NetSmart, so you won't be duplicating your work. Before it was you had to document on, I think it was Excel spreadsheets for OMH, and then you would have to document in your Health Home record. Those are moving to all one thing. So the training is the same, and the documentation is the same, but now it's only going to be documented directly into the Health Home record. Any other questions? All right, and I will keep everyone posted on this. Again, I have that meeting, like I said, it's my work group meeting on Thursday. One of the things that we are working on is policy for high fidelity wrap, because we will have that policy incorporated into Children's Health Home, kind of memorializing that population coming in. And one of the things that we are working on in that group is policy. Some things they've been a little bit flexible on. However, the documentation, the training, that all goes to fidelity of the model. So they are unwilling to kind of change some of that because it would change the fidelity of the model, is what we've been told. All right, so I'm going to send it over to Taylor.
Get a little break from all that talking. Hi, everybody. So I'll just briefly touch on something new that's coming. We will be starting to import gaps in care into NetSmart. I know we had previously talked about this probably close to a year ago. We've obviously had a lot coming up with audits and all of that kind of fun stuff, taking our attention away from this, but we are circling back to it. And hope to have a training forthcoming to you guys with a goal of by the end of Q4. So stay tuned for updates on this. We will keep you all posted. You'll have a fancy little tab in NetSmart where you will be able to see gaps in care that have been uploaded into the system for specific clients. And of course, we'll get into more detail as we kind of work out the kinks and get this system all up and ready to go for you all. Once we have it in NetSmart, we will also build a report and data den so that everybody can also track it that way. More to come on that soon. Go to the next slide, Jess. Okay, just to touch briefly on the quality notebook. Just please be mindful of due dates on the quality notebook. I'm not getting a lot of responses. Some CMAs are really great at sending them back. Others not so great. Please just keep me in the loop with items that are overdue. If you or your care managers need more time or are running into barriers completing an item, please just communicate that with me. I know there's things that come up when we're working with people and you're not always able to get it done on time with the due date that I've provided, but I would just really like to be kept in the loop and have an update on those items moving forward. And then lastly, if you guys have any questions, please don't hesitate to ask.
All right, Travis, are you back and do you want to speak to this, or did you want me to take this?
I am back.
Oh,
Hold on, one question in the chat from Lori. She said, can it also receive documentation of completion? I think she's referring to the gaps in care. So we will only be uploading the open gaps in there. And we'll touch more on this in training as we, kind of come up with a solid process for everything for you guys. But the care managers will be in charge of going in and closing those gaps in the system once the member has actually closed the gap. Okay, Travis, I'll pass it back to you.
All right, thank you. Looks like Lori's been raising and lowering and raising and lowering her hand.
Yeah, she keeps her sound, her audio isn't working right. So
Yeah. All right, I just wanted to touch for everyone on our redesignation. It's for our adult program is going to be wrapping up for the month-long audit this coming Monday. We have our exit conference with DOH. And they'll be going over the results for their month-long review of the charts that they've gone through. At that point, they'll also be giving us the feedback from the supervisory surveys that they've done to reach out to all of you supervisors, getting feedback from the network, which will be very valuable for us. We've had 2 breakout sessions throughout the month. One was on OMH Health Home Plus and HARP. The other was with the AIDS Institute on HIV Health Home Plus, both of which were very favorable. We actually, on the Health Home Plus HARP breakout, were above the state average in both of those areas in performance. So kudos to all of our providers in those populations and all the great work that you do. We were significantly above in those areas actually from state average. And the state was very impressed. OMH was very impressed with that and really was liking the types of things that the network was doing to support that work. And, you know, and I just wanted to make sure that we commended all the work that you all do in supporting that. And I made sure that we told our state partners that as well, because we, you know, without the work that you all do day in and day out, we wouldn't be having those benchmarks, those performances. And then the AIDS, HIV, Health on Plus as well. We have a small population in our network, albeit, but the fact that there is such a small population is a positive thing. That means that you know, we're keeping those numbers low for those folks that meet those criteria. And again, that was a good, favorable discussion. And you know, we were very happy to hear that and have that discussion with the AIDS Institute. So two good discussions. And I just wanted to thank everyone again for all that great work. And you know, we're looking forward to the exit conference. It's been a long month. I do want to thank everybody. I know there's been a flurry of emails that have been going out from Courtney to supervisors and care managers over the month. The last push was today. I know some of it might be a little annoying, but we have to answer on Monday a billing download support file report. We had to pull right at the beginning of the month and submit to the state. We have to answer to that particular report when we come to the table on Monday, and they're going to want to have answers to those folks that are listed on that report. And a number of those people that have been reached out to were particular individuals that were identified on that report. So we have to be able to give some sort of a status update. So that's why folks have been reached out to. So thank you for the feedback. We appreciate it. And you know, we'll keep on trucking. So that's the status update. We're going to have follow-up clearly from the redesignation visit. There always is. There's always opportunities for improvement. So, you know, stay tuned for that as we get into that next phase. But we're getting close to the end. Any questions on redesignation at this point? Anybody had?
Hi, Travis. If anyone does have any questions on that, Lori just did put a question in or a statement that pertaining to the gaps in care. She just said that the gaps are usually done, just not billed correctly for insurance to see. And yes, Lori, that is true. Sometimes it is all how the provider bills the service and what code they use as to if that triggers the closure of that gap. With incorporating the open gaps in care into NetSmart, it will allow the care manager to record the status of that gap in care. And I believe there is a text box. So that will allow us to send that back to the MCOs and report back to them to see what has been closed. And if they have any questions, then we can have the discussion that, yes, this was completed. However, it was billed incorrectly by the provider, but this has been done. So yes, they do that based off of claims data. And if they're not using the correct codes, then it shows that it's open.
Yeah, our hope is to get those reports tied right to NetSmart, as Taylor is indicating, so that it becomes more seamless and we can tighten up the process so that we can get away from that. And the coding issue is something that's a statewide issue, obviously. So we need to be more diligent and follow up on that and call it out when it is happening, obviously. So good thing to point out, Lori. Anything else anybody had? And I just wanted to mention here, we've had, as folks can see on the bottom right-hand corner, a handful of organizations for quite some time now that have been pending at various stages on onboarding. I've reached out to our state liaison, looking into that status for those folks. So we're doing some follow-up on that because we want to move some of that along to get those organizations into our network. So we're excited about that happening. So we're just trying to nudge that along a little bit. So more to come there. But other than that, we didn't have anything else today unless anybody wanted to talk about anything. We've had some long meetings in the last few months. We wanted to shorten it up today if we could. All right. Well, thank you all as always for everything you do. We appreciate it. Have a great rest of your day.